that we were within hours of reaching an agreement. The bargaining session, especially early Sunday morning, was really emotionally draining as we reviewed where we were in negotiations and looked at the work that still needed to be done. And the bargaining committee realized that we have, at this point, met all of the commitments that we have made to our members, and we were incredibly proud of the work that we have done, but we still have not finished the work that we promised our patients and the community, and that's why we're still out here. So it is true that negotiations broke down related to staffing, and very specifically the ratios for our medical surgical units. And it was a difficult conversation amongst the committee because in 2016, as our members all know, we agreed to language, Catholic Health and CWA agreed to language that said that Catholic Health would staff to their grids. And when we looked at our grids, all of the information that we had been provided, we reached the conclusion that the grids called for a 1-to-4 ratio in the medical surgical units. The problem, as you all know, is that Catholic Health has not lived up to their grids. If they had staffed to the grids, we would have never gone on strike. We wouldn't be here right now. But they strayed into the 1-to-6, 1-to-7, 1-to-10 areas in med-surg, and it wasn't uncommon for our critical care nurses to be caring for 1-to-3. And I don't even want to start talking about our emergency. We talked about what we wanted to do and decided that it was critical for us to finish the fight that we had started. It was critical for us to live up to the commitment that we made to the community, and to resolve issues related to staffing. We know that the labor shortage is a concern right now, and that part of Catholic Health's concern is that they won't be able to hire enough nurses, nurses' aides, ITAs to meet the ratios that we've agreed to. But early Sunday morning, we developed an MOU that essentially said, look, if you can't get the job done, we have the clinical staffing committee, which is a requirement under the New York State legislation, and the issue can easily be put to the committee, and we will work with you. So if you are using every method that you can to bring new RNs and aides and ITAs into the hospital, and you're not able to meet the ratios, then we are going to work with you to figure out what we have to do to meet them. And we put our commitment into an MOU, which we really thought would be the settlement to the agreement. So, I feel like we were literally one piece of paper away from reaching an agreement, and it was in Catholic Health's hands to get it done, and they just walked away from it. So there has been some question, and I think Catholic Health is trying to plant the seeds that our members are fracturing, and I want to make sure that we're very clear that we are talking to our members regularly. People went out on strike to fix work conditions and staffing, and they are telling us don't finish until you get it done. Catholic Health, in a effort to threaten and put pressure on our striking members, discontinued their medical benefits effective today, and You know, we don't want any member to worry about that. We have a member relief fund that is um, funded by a portion of our members' dues money, which right now is $440 million. So we are going to continue to pay our members their strike benefits. They are collecting unemployment. We're trying to work out some snafus related to that, but we heard members are, are getting checks, and CWA will cover all necessary medical expenses for all of our striking members. So if we have people that are pregnant, that have chronic medical conditions, that require frequent medical care, CWA will pay the COBRA. We will not let anybody fall off the charts that way. For people who don't have chronic medical problems, but there are medications or doctor visits or emergency room visits that come up, CWA will pay every penny of those expenses. So Catholic Health can threaten or try and threaten and scare our members all they want, but we're not going to let anything bad happen in terms of the health of our members. So I was in the parking lot today, pulled into the parking lot today, and I have to tell you guys that the support from the community has been incredible. There were huge pallets of fruit and vegetables and other non-perishable items set up. We have a solidarity fund set up for people that are experiencing significant financial hardship, and literally thousands of dollars have been contributed. And where's Haylin? Haylin, can I tell them who our most famous contributor is? Can I tell them who our most famous contributor to the Solidarity Fund is?
Oh, yes, yes.
So we have been spending a lot of time talking with Bernie Sanders' office this week, and he sent a very generous check to help all of the people that are on strike, and it's pledged that he is also going to help us in any other way that we can. So a big thank you to the community, not just to Bernie, but to everybody who has contributed to that fund and is helping our members that are in financial duress right now. So I think that's all I have to say. Where's Cabana? Did you have something you were going to say? We have some members of the bargaining committee and other members that...
Deborah, can you just restate, though, for us, you said Catholic Health walked away. You were one piece of paper away.
Yes. So literally, we worked on staffing almost the entire last morning that we were together. We really were, when I tell you there were tears and arguments and incredibly emotional discussions about what we should do in that room. I mean, it all took place. We wrote up an MOU to give Catholic Health the insurance that they needed, that if we couldn't meet staffing the grids, then there was another process that we would follow. I think we waited almost 3 hours, 2.5 to 3 hours for them to evaluate that statement, that MOU, and they said no. And, bargaining was over. So we were there. We were prepared to get an agreement. We were so prepared to get an agreement that we have our final bargaining report to our members drafted. When you're on strike, you have to negotiate a back-to-work agreement, and that could take days in itself to negotiate the back-to-work agreement. But we drafted it. We got it going. We had our attorneys looking at it. We had the bargaining committee looking at it. Because we were so determined that we were going to get an agreement that night. But we didn't. They walked away.
Did you clarify that was last night?
It was Sunday morning.
Sunday morning.
So we bargained all last week, Friday into Saturday morning till about 3 a.m. and then until about 6 a.m. on Sunday
Okay,
morning.
So nothing's changed since 6 a.m. yesterday.
Nothing's changed since 6 a.m. Sunday morning. Yep.
Is that the last remaining issue?
Last remaining issue.
Well, I mean, wages and fringes, obviously. Do you have that worked out?
We have an agreement in principle.
So
We do.
Staffing is it.
Staffing is it.
But hasn't staffing been the issue from the beginning?
It's and I think that was, and I want members from our bargaining committee to talk because they were so eloquent in expressing their concern that the primary reason that many people walked out the door was to fix their work conditions. People don't want to be in a situation where they feel like they can't provide the care to their patients that they should be providing. And, you know, if we don't finish it up strong, then shame on us. And, you know, the whole bargaining committee felt that way. We're not going to let our members down. We made commitments to people. And the reality is we're in there bargaining every day, but just look at the people who are out on the picket lines. People are picketing, people are working in the office, people are taking care of the financial and emotional and medical needs of all of our members. Our members are just rising to a whole new level of strength and leadership, and you know, they're doing their part to make sure we get a good contract, and so we're not going to let them down at the bargaining table. We're just not. Come on. And we got members of the bargaining committee. One of our executive board members from the local is here. Go ahead.
So with all that being said, together, us as workers, we fought to get Buffalo through the pandemic, and together we will stand strong, and we urge Catholic Health to give us a fair contract and do what's right for our patients. That's it.
Name?
Tell us your name.
Kivana.
And could
Spell
you
it,
spell
please.
it?
Kev as in Victor, Onna, Neely, Neely.
And you're part of the negotiating committee?
No, I sit on the executive board for CWA 1133.
What do you do here?
I'm an EKG tech and a certified nursing assistant.
Thanks, Kavana.
Backbone of the hospital.
Yeah. Anybody else before you want?
Yeah, I just want to say that we all are healthcare workers, and the number one reason we walked was our patients. And the last piece of this is our patients. The reason we need this piece of paper is for the community and our patients. It's to make sure you stay safe and we can get you better. And that is why we just cannot go back in until this one piece of paper is done. And I just want to make that very clear that the last piece of this is the patients.
Name?
Can you tell us your
Corey Webb, and I am part of the bargaining committee.
First name, spell your first name, spell your last.
CORRINEWEBB.
And can I just say one
Go
thing,
ahead.
too? So I just want to tell you how the bargaining committee felt when we thought we had this in the bag. Becky brought in champagne. We were high-fiving when we went in Saturday like at 11 o'clock. We seriously thought we were going to wrap up and pack up Saturday because that's how confident we were. We had an agreement. Like, seriously, we went from high-fiving each other Saturday morning to leaving each other in tears and bickering with each other at the next morning, Sunday morning at 5 a.m. So we seriously thought that they were going to do the right thing, and it's clear they didn't.
Okay, and as usual, name.
Cheryl, Cheryl, Darling, Darling.
What do you do here?
I'm an immediate treatment assistant in the CVICU, and I'm on the bargaining committee.
So Deborah,
Alright.
what's next? Where do we go from here?
So, we have worked diligently today, number one, on making sure that we have all of the processes and member relief fund dollars in place to deal with the health care issue. We have reached out to all of our contacts in the political world to help get the message through to Catholic Health that it is critically important to get this done. 'Cause we're getting calls from people saying, what's going on? What can we do? What can we do to help? And, you know, we're talking about the issues and saying, you know, help us get it done. Anything you can do to help us get it done, we would appreciate. So, you know, we're working, even though we're not at the bargaining table, we're continuing to work hard behind the scenes to get it done.
No bargaining sessions set.
Not that I know of. I've talked to the federal mediator, texted with him a couple of times today, just to touch base, and you know, so far we have not been called into negotiations.
So in layman's terms, because I know it's complicated, where is the division on staffing? Like what are you saying? What are they saying? Where
So in layman's terms, all of the national literature, the law the legislation that we had proposed in New York State, the national legislation that is now being proposed, federal legislation, calls for a 1-to-4 nurse to patient ratio in medical surgical areas. And that's what we're striving for. The hospital is at 1-to-5. And the concern that we have is that if they start to slip, you go from 1-to-5 to 1-to-6 to 1-to-7 back to 1-to-10, you know, and then we're in trouble. So we feel that it's critical to get that ratio at 1-to-4. It's where every professional that we've spoken to feels that we need to be at to give the best care to our patients, and you know, that's what we want to see.
When you say nurse, you mean RN. You're not talking.
I say RN, but we've had discussion with them, and that's part of the memorandum we gave them, that you know, LPNs have not been used in acute care, have not worked as part of the healthcare team in acute care settings for years, but there's no reason that LPNs can't be working in the hospitals. They were a huge asset and an important part of the team when we did work with LPNs in the hospitals. We're talking about, you know, what we would need to do to increase the number of nurses aides and ITAs that we have, because, you know, the more help you have from your support staff, you know, the more the nurse can focus on the work that they have to do. So healthcare delivery, no matter what anyone says, and we are really now talking about the nurse to patient ratio, you know, it's a team approach, and it takes every member of the team to get the job done. And it doesn't matter if you're the employees that are cooking the food and getting the food to patients, or keeping the hospital clean, getting the trash and dirty laundry out. I mean, no matter what you do, it's a team effort to care for our patients. And, you know, we want to make sure we do right by all members of that team.
Okay,
Go ahead.
Jackie Tipio, registered nurse in the MIU, president of CWA 1133. I just want to say that over the last couple of years and throughout this entire process, Catholic Health has really demonstrated unethical behavior towards employees and towards all of the patients. And I think this is their one chance to really make themselves look better now, because it's out in the community's aware now that we're just fighting for a good ratio. And this is their chance to step up and establish ethical behavior and perhaps start everything going and the ball moving in the right way.
How often has some civilian said to you, the last time I was in a hospital, there never seemed to be a nurse around?
How often, or the last time? Quite often. I mean, more than not. Or what they'll say is, the nurses come in, and I'm afraid to ring the bell because I see how short they are. And that's, the patients are worried about the nurses. And, and the nurses aren't saying anything. It's just that you can see when a nurse is running ragged and just can't keep up. So, but thank you, everybody. And thank you to the community and to everybody that supported us, too. This has been phenomenal. Every labor has come out. Everybody in the community has come out. And all the staff members have just come together. I think this has built just like a family stronger than we've ever had. This has really been incredible. So thank you to everybody. Thank you to Chrissy.
Hey, Deborah, just one final closing thought, if you could.
Yes.
I'm assuming they're at 1 to 5 staffing ratio. You're at 1 to 4. If they come to 1 to 4, this ends.
I think if they come to 1 to 4, this ends. It's that simple. We got some I's to dot and T's to cross and some papers to sign off on, but if they come to 1 to 4, this is over. That's literally how close we are. Our members are, somebody just said to me before the press conference started, I never thought I'd say it, but I miss being in there. I miss taking care of my patients. I'm willing to do what needs to be done, but I know where I'm supposed to be and what I'm supposed to be doing. People want to get this finished. They want to go back to work and start taking care of their patients again, and we want nothing more than that as well.
Correct. Thank you.
Yep. All right. Thanks very much, folks, for coming. We really appreciate.
Okay. Thank you, guys.
Yeah.
You guys being here.
Where he's from. Yeah. Okay.
Can we just talk to you real quick about the discontinuation of benefits?
Sure.
I just didn't want to hold anyone up.
Yeah.
It's kind of cold out here.
Oh, sure, no
Okay,
problem.
Awesome.